the most common fears that I hear from people who are considering reaching out for psychiatric care is this. If I tell you what I'm really thinking, are you going to call the police? Are you going to put me in a hospital? Am I going to lose control of what happens to me? And I want to address that fear directly because it keeps a lot of people from reaching out and it keeps people quiet. It keeps them silent. And silence makes things harder, not safer. So, as a psychiatric provider, I am required by law to take action to help keep you safe if I believe that your life is in immediate danger. That's a legal and ethical responsibility that I take very seriously. But here's what that actually looks like in practice. Having the thought, gosh, I wish I didn't have to wake up again tomorrow and do this all over again. Life feels heavy, swimming through molasses, feeling that life has become unbearable at times. That's not the same as being in immediate danger. Those kinds of thoughts are actually more common than most people realize, and they are important clinical information. They tell me, as the provider, something about the level of pain that you're carrying, and they help me help you better. The threshold for emergency intervention is not, I'm struggling, I've had dark thoughts, I've had thoughts of not wanting to wake up, what if I drive off a cliff tomorrow? It's a very specific clinical and legal standard, and your provider is trained to assess that with you collaboratively, not to react with alarm to every difficult feeling that you might bring up in a session or during your appointment at all. What I can tell you is this: disclosing how you are really feeling, even though the thoughts may scare you, they may be uncomfortable, you may think they sound weird or whatever, that opens the door to better care for you. Keeping those thoughts hidden actually closes that door. It doesn't allow me as your provider to see the full picture. And just quickly, if you are in crisis right now, please reach out to 988 Suicide Line. Call them, text them. You don't have to be in that alone. But that is a very common question that I get. And again, the answer is, while there are clinical, legal standards and guidelines I do have to follow, it's only if you are in immediate danger or if I feel that your life is in immediate danger. And again, that's something that you talk to your therapist or your provider about collaboratively. Another question I get: will I be hospitalized if I'm honest about how bad it gets? That depends. Is that in your best interest? Is that going to be helpful for you? Sometimes hospitalization can be helpful in a short term to help stabilize you on medication and keep you safe and kind of give you a break from living day-to-day life and all the stressors and pressures that puts on you, but not always. And that's something that you and your provider have to decide on together. Another question: do I have to tell my psychiatrist everything? No, you don't have to. We appreciate if you do tell us the majority of what's happening, because the more information that we have, the more knowledge we have, and the more we can let our education, training, and lived experience help you. You don't have to tell us everything, but I certainly, as a provider, I hope that you would feel comfortable and safe enough to tell me the majority of things that are bothersome to you. Another question I get is, what if I'm embarrassed to say what I'm actually thinking? This happens all the time. I see this a lot in individuals that may have, for example, intrusive thoughts that you don't really want to have, or thoughts that you aren't thinking about. You're not actively searching or viewing things, but you might have these thoughts just kind of like pop in your mind all the time. And they can be scary. Like the example of, what if I'm driving in my car and I drive off a cliff? Or what if I get hit from behind? Or what if I fall down the stairs and break my neck? Sometimes those thoughts can be scary and alarming. And there are things that we can do as your provider to help you with that may or may not be related to medication when it comes to that. So no, you don't have to tell us everything. And please don't be embarrassed. We are not here to judge you. Most of us have been in the medical field many years, and there's not much that can surprise us, shock us, or make us judge you by any means. Most of us are in this field because we truly enjoy what we do. We like seeing people get better and not need to come see us as often or as frequently, right? That's the whole goal, is to help people feel like themselves again. Another question I get is, can I tell you something I've never told anyone? And that's pretty common as well. A lot of people wonder if they disclose some type of abuse or assault that happened many years ago, if that's going to lead to a trial and a court date and loss of job and having to disclose to their family, friends, spouse, parents, etc. And yes, you should be able to feel safe with your provider. I always encourage my patients to feel safe with me. I want to promote that environment and nourish that as much as I can. But just because you disclose something that you haven't told someone else before does not mean that we have to disclose it to everyone, especially in those types of scenarios. Again, immediate danger, immediate loss of life, those things we are legally bound to disclose. However, if it's something that you haven't told anyone before, if you're having odd thoughts, if you're having tendencies, if you're having behaviors that you're curious about, or you're wondering, does anybody else have this? This is weird that I'm thinking these things. This is not like me. People around me would never guess that I have these thoughts. That's okay. We're not here to judge you. Again, we want you to feel comfortable to tell us, because I'm here to help you. And if I don't know what's going on, or the full scope, the depth and gravity of what's going on, I can't really help you very effectively either. And then one of the last questions that I'll talk about in this video is, what if I cry during my appointment? So this actually happens more often than not. People will disclose things or talk about things that they've dealt with for years, and it's never been a problem. It's not part of your day-to-day life. It's like, oh yeah, this happened, X, Y, and Z. Or, I've been feeling pretty, under pressure at work, or I feel really constrained or restricted at home or in my marriage or with my kids. Sometimes I wish I didn't have kids, right? These are all things that are very common, and a lot of people think about these things or have these thoughts more frequently than not. Just because other people aren't talking about it, it may make you feel a little isolated, but please don't think that we haven't heard that before. That's actually pretty common, and I think it's part of being a human. It's part of a normal experience of being a human. So I just wanted to jump on here and do a few questions. I'm going to do this in a series. Next, we'll talk about medications. A lot of common questions I get about medications, but if you think of any questions that you're afraid to ask or you're hesitant to ask, please feel free to drop it below in the comments. I'm happy to answer those as well and throw them in a video that we do next week. I drop weekly content, so please like and subscribe. And again, if you are having any kind of suicidal thoughts or thoughts of harming yourself or someone else, please reach out to 988, your nearest emergency room or your nearest provider. Again, this is for educational and informational content purposes only. This is not to substitute medical or psychiatric care. I just wanted to go over some questions that are quite common, that come up frequently, that most people are afraid to ask, and that's what this series is going to be about.